All right. Thank you, everyone, for being here with me at this Lunch and Learn. Hopefully, the information will still keep your appetite going. You have some nutritious food with you. So, I'm Janelle Smith. I'm a registered dietitian within the Division of Digestive Diseases, and we are three dietitians specializing in digestive health and wellness, including colorectal cancer, number of digestive diseases, and other types of cancers. So, if you have patients or if yourself would like to visit with one of us for your individualized needs, we're available at three different locations. And right now, we're all offering telemedicine as well. So, today we're going to go over some facts and figures about colorectal cancer and really look at the role of nutrition and what does the evidence tell us? How impactful is nutrition in preventing and or causing colorectal cancer? And then we'll look at pro and anti-inflammatory foods and some cooking methods that can help us to prevent colorectal cancer. So, to get started, we know that colorectal cancer is actually the second leading cause of cancer death in both men and women combined throughout the world, contributes to about 700,000 deaths annually, and is largely preventable. In the US, we're expected to have over 100,000 new cases in 2021 and about 52,000 plus deaths this year just from colorectal cancer. We know that through screening and lifestyle interventions, we can prevent about 60% of colorectal cancer deaths. So, combined with nutrition, we really can make a huge difference. Here is kind of an older image, but we have newer evidence from the World Cancer Research Fund and from the American Institute for Cancer Research about diet, nutrition, physical activity, and colorectal cancer. This was last published in 2018. And then just this year, just last month, in the journal in JAMA, we have a publishing of the role of diet in colorectal cancer incidence, an umbrella review of meta-analyses, prospective observational studies to help us understand the evidence. So, strong evidence, which I'm going to talk about for these different recommendations, includes either convincing or probable. They've rated it in terms of how much evidence exists. Limited evidence may mean that there's suggestive benefit or no conclusion. And overall, we absolutely need more research in order to better understand these relationships. But so far, we're going to especially talk about the convincing and probable relationships. So the first one is physical activity and body fat. For physical activity, kind of regardless of body size, we know that it helps with improving insulin resistance, reducing inflammation, stimulating digestion, and reducing transit time. It's unclear if it needs to be associated with weight loss to reduce colorectal cancer risk. So at this point, physical activity may be beneficial all on its own. Body fat, which can be measured as BMI or waist circumference, both are correlated with higher colorectal cancer risk. And we think that this is mostly through increased insulin, which promotes cell growth and inhibits cell death. Similarly, if we do have constipation and decreased transit time, there may be kind of a buildup of stool in the gut. The ways that we would measure obesity could be through BMI, with obesity being defined as a BMI of 30 or greater. We can also measure it via waist circumference, with a high risk being 35 inches or higher for women and 40 inches or higher for men. And this aims at measuring the visceral adiposity that is more challenging or more of a sign of insulin resistance. And with both of these measures, though, we need to keep in mind the patient's weight history and genetics and ethnicity. So I'd say we need more information to better define when weight loss versus other protective factors are really influential. We can also look at the waist to hip ratio, and we can see here basically how the different ratios associate with risk. So waist to hip ratio of 8.85 or more would come with a high health risk for women, and 1.0 or more high health risk for men. The next factor that is associated, has convincing evidence that it impacts colorectal cancer risk, is the intake of processed meat. There's a significant number of evidence that says that smoked, cured, salted, and meats with added preservatives are causing colon cancer, or at least some of the formations that can turn into colon cancer. So when processed when they're with high fat or under high temperatures, these types of meats form heterocyclic amines and polycyclic aromatic hydrocarbons that actually change the way that the cells in our colon can differentiate and can actually promote abnormal differentiation. A significant amount of processed meat, which is 50 grams or 1.7 ounces or more per day, which is about one hot dog, is associated with an increased colorectal cancer risk. We need more evidence on, well, how often could someone have bacon and have and not have an elevated cancer risk? But certainly a regular intake of these meats is not healthful for our gut. There's also very strong, convincing evidence that smoking and excessive alcohol intake increases colorectal cancer risk. Smoking 2 packs daily increases the risk by 40% and doubles the risk of death, whereas for alcohol, having more than 1 ounce a day also significantly increases colorectal cancer risk. So in terms of alcohol, it's important for us to think of moderation and kind of our Mediterranean diet guidelines of what is a serving of alcohol. Typically, moderation is 2 drinks for men and 1 drink per women per day. The next nutritional component is red meat, and this is independent of processed meat. There's, depending on which study you're looking at, there's either convincing or probable evidence that red meat intake increases colorectal cancer risk. And red meat includes beef, pork, lamb, and goat. And certainly the cooking method of this meat also significantly increases the risk, which how we talked about how the gut cells kind of differentiate and can become more abnormal. We also know that the heme iron in red meat is tumorigenic and carcinogenic. Heme iron is from animal proteins, whereas non-heme iron from plants is not associated with increasing colorectal cancer. There is evidence that many foods are protective for decreasing risk of colorectal cancer. These include fruits, non-starchy vegetables, whole grains, fiber overall, whether it's from a variety of plant foods. Also appears that dairy and calcium-rich foods can be very protective. And then there's some suggestive evidence that vitamin C, fish, and vitamin D may be protective. Certainly nuts would fit a lot of those categories as well. So there's probable evidence that fruits and vegetables provide anti-tumorigenic agents such as fiber, carotenoids, vitamin C, vitamin E, selenium, folic acid, phytonutrients. These antioxidants can actually capture free radicals and kind of downregulate any abnormal changes that could be happening in body cells. And we know that fiber is fermented by gut bacteria to produce short-chain fatty acids and kind of promote a certain pH in the gut that prevents the abnormal differentiation of cancerous cells. So certainly the the components, the nutrients in the food itself are helpful, and also the fiber, which then leads to healthy gut bacterial fermentation, is protective. Berries, especially raspberries, seem to have more evidence that they're protective of colorectal cancer. So if we're thinking about a healthy plate, we tend to think of wanting half of the plate to be full of fruits and vegetables to get a variety of colors, to get all of the different nutrients and fiber. Whole grains and other sources of fiber, like from nuts and seeds, also have some probable and convincing evidence that they help reduce the risk of colorectal cancer. So like I was saying, the fiber helps our microbes synthesize short chain fatty acids. It reduces the transit time overall, and it can change the pH in the gut. And it also can help prevent insulin resistance. Grains tend to be high in fiber if they're whole, have antioxidants like vitamin E, selenium, copper, zinc, lignans, and other phytonutrients. So especially the bran and the germ of grains, which is the outer part of the grain, the whole grain, is very helpful. That's where we get the majority of the benefits of eating these foods. Dairy and calcium also has some probable convincing evidence that it is helpful for reducing colorectal cancer risk. So there have been 20 studies, that 11 of which compared high with low calcium intake, and 10 of which showed an inverse relationship of consuming more dairy with a decreased colorectal cancer risk. There was a 6% decrease in colorectal cancer risk for 200 milligrams per day in the colon, in men in particular. And the proposed mechanism is actually through lactic acid producing bacteria, potentially lactoferrin, and vitamin D, and the production of butyrate. Butyrate is one of the short chain fatty acids that can be produced from gut bacteria, that really helps feed the healthy cell production within the colon. Then we have vitamin C rich foods, which have limited evidence. There have been a couple, I guess 18 studies, but small, significant positive impact on colorectal cancer risk, and a 6% decreased risk per 40 milligrams per day. What we think the mechanism of action is being an antioxidant. This can inhibit lipid peroxidation, can reduce nitrates, and inhibit carcinogen formation, and protects DNA. A lot of the factors that can lead to abnormal cell changes in the colon can be stopped or inhibited by antioxidants like vitamin C. Vitamin C is rich in foods like bell peppers, guava, kiwi, currants, mustard greens, and citrus. Vitamin C is best consumed fresh and not cooked for a long time. So vitamin C actually degrades the longer that you cook it. So canned foods tend not to have as much vitamin C as fresh or frozen. Sauteed or kind of al dente steamed vegetables will have a higher vitamin C content than something that's been boiled for hours, for example. Fish consumption also has limited evidence to help prevent colorectal cancer. There's an 11% decreased risk per 100 grams per day, which is about a typical serving of fish, 3.5 ounces. Certainly there's variability in terms of how many days per week, what types of fish, how many fatty fishes, how much of the omega-3 fatty acids. So we do need more information or more research to better define this. It does seem that the fatty fishes that are higher in omega-3 intake are going to be more anti-inflammatory, as we know from a lot of research in the Mediterranean diet. Vitamin D has limited evidence to also lower risk, 5 to 7% decreased risk per 100 IU daily intake. It's unclear if it's significant, if it's a dietary supplement, or if the vitamin D comes naturally through foods. There have been 12 studies just on serum vitamin D levels, and 8 reported an inverse association, but they're not statistically significant. And certainly they seem to be affected by seasonality, sun exposure, obesity, underlying disease. So we're not sure if when we're measuring vitamin D, serum vitamin D, if we're looking at these other factors that affect a person's health, or if we're actually looking at their vitamin D status. Nevertheless, vitamin D-rich foods are excellent to consume. They include salmon, fortified dairy, egg yolk, and mushrooms that are grown under UVB light. So if we put all of these recommendations together, what we have is a Western diet with low physical activity, high saturated fat, and inadequate intake of fruits, vegetables, whole grains, beans, and overall fiber, high intake of red meat, processed meats, increased alcohol intake, smoking, and obesity. These are all pro-inflammatory factors. Pro-inflammatory lifestyle that contributes not only to colorectal cancer risk, but other types of cancer and chronic health disease. Whereas an anti-inflammatory diet is one that has a high intake of fruits and vegetables, a high intake of fiber through fruits and vegetables, whole grains, beans, legumes, leafy greens, includes a good amount of omega-3 polyunsaturated fatty acids, such as from fatty fish, flax seeds, walnuts, olive oil, and then a moderate alcohol intake. And I will give you some more tips and ideas on how to follow an anti-inflammatory diet in just a moment. But lastly, I want to talk about cooking methods to reduce cancer risk. So we know that any animal protein, when cooked, will produce these HCAs and PAHs when cooked at high temperatures above 300 degrees Fahrenheit. So it may not be that we have to completely eliminate cooking meat, but particularly those that are higher in saturated fat, like the red meats, are going to produce more of these, and the higher temperature that they're cooked at will also increase more of these. So to reduce these carcinogenic compounds that promote abnormal cell growth, we can avoid heating or cooking our meat over an open flame or a hot metal surface. So something like a baking dish or a glass dish could be much better. Avoid prolonged cooking times. So something that is seared or baked for 20 minutes is going to be lower in these compounds than something that is slow cooked throughout the entire day. You can use a microwave oven actually to cook meat prior to exposure to high temperatures. Microwave ovens are very effective at heating things in a short amount of time and preserving their nutritional value. We can also continuously turn meat over and over when it's on a high heat source. We can remove charred portions of the meat and refrain from using gravy made from meat drippings. So basically, less cooked is better as long as it is free of bacteria. Make sure that our meat is safe in that way. So here's some tips to integrate these principles into your life. Maybe institute something like meatless Mondays or fatty fish Fridays. Find kind of a way to have routine in your diet that incorporates more plants and more fatty fish. You might be ready to make one meal per day, vegetarian or vegan or plant-based. You might, rather than do that, you might say, okay, well, meat is more the treat than the main event. So in my turkey chili, it's going to be a majority beans and vegetables, and I have a little bit of turkey, or I have less turkey in there than I usually put. Or I use a chickpea pasta that provides most of my protein and just a few ounces of chicken, lots of vegetables. We also recommend that you try new grains, new whole grains that might not be a typical part of an American diet. Farro, buckwheat, bulgur, quinoa, these are all wonderful sources of fiber and antioxidants. And then trying to eat the rainbow each day. Purple, blue, green, yellow, orange, red, and white actually is an important color when it comes to fruits and vegetables. See if you can get every color almost every day, or combine different colors in the same meal. This is going to really help you to get various sources of phytonutrients and antioxidants. And here's just a sample menu that you could actually achieve on campus at our cafeterias at UCLA. Egg white omelet with spinach, onion, tomato, whole grain toast, berries, or hot cereal. Any vegetarian or bean-based dishes, fatty fish in our cafeteria. Those are all really wonderful plant-based, plant-forward items available to you. So I'm providing references, but I want to thank you for attending and hope that you learned something important today.